I got a rec for a shoulder series, so I'm going to come get my patient. Hi, Bernice.
Hi.
What's your last name?
Pumpernickel.
And your birthday?
1/1/1801.
All right, so I'm going to be taking x-rays of your shoulder today. My name's Brianne. I have my patient change into a gown, everything from the waist up off. And is there any chance you could be pregnant?
No.
Okay, and she's shielded. Good. So I'm going to set my technique at 80 kVp. I have my automatic exposure set, but the mass should be anywhere from about 6 to 15. I have my center cell detector on and our chest stand. I have my SID at 40 inches, and my tube is detented to the bucky, and my light field is the size of a 10 by 12 inch cassette, and the cassette is going to go in lengthwise with the strip facing the top of the head. Make sure my cassette's pushed in, and my patient's ready. Ready to go. Shoulder that's hurting you today?
Yes.
And what happened?
I fell yesterday.
Okay, where's it bothering you?
Right here.
Okay. So, I'm gonna stand right here. So we're gonna center for this 1 inch distal and 1 inch medial to the coracoid process. And make sure my right marker's on there. And we're gonna do a neutral position first, so she's just gonna leave her arm just as it naturally hangs. So hold still, just like that, Bernice. Beep. Okay. And then take out this film and run it, and put in a new film. Once again, we're going to put it in lengthwise. And this time we're going to do our internal rotation. Okay, Bernice, I'm just going to have you move your hand out and turn it inwards like that. All right. Hold still just like that. Beep. Okay, I'm going to run this film. And I'm going to put in a new cassette for my external rotation. Okay, Bernice, this time I'm going to have you turn your hand outwards. Hold it just like that. Beep. And I'm going to run this film. So I'm putting my next film in for my wide view of the shoulder. Once again, it's going to be 10 by 12 lengthwise with the strip facing up. I'm going to stick my film in, and I'm going to have my patient rotate 45 degrees on the affected side, with the affected side towards the IR. She's going to rotate inwards 45 degrees, and she's going to bring her hand across, and her scapula should be perpendicular with the cassette. And I'll just do it just like that. Our central ray. Correct location. Okay, hold still just like that. Got my marker on. Beep. Okay. So I kept my technique the same at 80 kV for the first 4 views. But for our axillary shoulder view, I'm going to move my kV down to 70. And I have my mass set at 10 right now, but that can range anywhere from about 6 to 16 in the mass. And we also switch it to tabletop. So I have Bernice sitting down in a chair here. I also have a small wedge, and I have my cassette sitting on top of it. Okay, Bernice, I'm going to have you scoop, sit up straight, and scoop as close as you can to the table. All right, now I'm going to have you stretch out your right arm as far as you can over, and lean over the table. Okay, I'm going to have you move your head to the side as much as you can. Look down. All right. And I'm going to put an angle on the tube that goes with the angle of her shoulder. We're going to center at the top of her shoulder. All right, make sure we're in the center of the cassette here. And I got my marker on, so keep your head to the side. Got my marker on. All right, hold still just like that, Bernice. Beep. I'm going to run this film. Okay. Go. We're done with our shoulder series now. We have our images brought up here on the computer, and there is some criteria that will make the images of acceptable diagnostic quality. So this right here is our neutral shoulder position. The greater tubercle should be shown slightly superimposed over the humeral head. The arm's just in a relaxed position. You can see the clavicles and the acromion, and the humeral head should also be slightly superimposed over the glenoid cavity, and you can also see the outline of the scapula in the background. Alright, this is our internal rotation view of the shoulder. As you can see, there's evidence of collimation and markers, as in the last image as well. So for our shoulder view with internal rotation, the lesser tubercle should be in profile and pointing medially. The outline of the greater tubercle should be superimposed over the humeral head, as you can see it right here. And there should be a more overlap in the glenoid cavity space. The greater tubercle is in profile on the lateral side of the humerus. The outline of the lesser tubercle is seen between the humeral head and the greater tubercle right here. And there's also a slight overlap of the humeral head and the glenoid cavity. And for our wide view, the acromion is projected laterally and is free of superimposition. The coracoid is superimposed or below the clavicle. We have a view of a lateral view of the scapula. And once again, there's collimation and markers. And for our superior inferior axial view of the shoulder, you have an open scapulohumeral joint. You have the coracoid process projected above the clavicle. You have the lesser tubercle in view, and you can see the AC joint through the humeral head right here. And all of these images together make a proper diagnostic series for shoulder.